Okay, we're going to look at some deep muscles in the hip. Okay, let's remove the glute maximus. Okay, we did a video earlier on the piriformis. So now we're going to look at these muscles in here. Okay, we'll start with the superior gemellus. Gemellus means twin. So we have this superior gemellus and this inferior gemellus. Okay, a posterior view. The origin of the superior gemellus is on the ischial spine, and its insertion is on the greater trochanter. Action, external rotation, adduction, and extension at the hip. Okay, the inferior gemellus has its origin on the ischial tuberosity and ischial spine area. Over to the greater trochanter, and the action is the same: external rotation, adduction, and extension at the hip. Quadratus femoris has its origin on the ischial tuberosity and insertion over on the posterior aspect of the greater trochanter, specifically this area, the intertrochanteric crest. Okay, action is external rotation and adduction at the hip. Obturator internus. Okay, remember the hole in the bone here is the obturator foramen. So the obturator internus has its origin on the obturator foramen, obturator membrane, and its insertion on the greater trochanter. It's going to allow for external rotation at the hip, adduction, and extension at the hip. Okay, if we have an internus, we have to have an externus, which is here. Okay, here's a posterior view, and here's an anterior view. Okay, so we have the origin on the obturator foramen and obturator membrane and the pubic bone, and its insertion on the trochanter, greater trochanter. Action, adduction, and external rotation at the hip. We're going to look at the quadricep group. Okay, so we have an anterior view, and we'll zoom into the front of the thigh here. So quad is 4, so we're going to look at 4 different muscles. Let's do a quick rundown. So we're going to have the rectus femoris, vastus lateralis, vastus medialis, and then underneath the rectus is the vastus intermedius or intermedialis, depending on the book or author you read. So we have 3 vastus muscles based on location. This is the outside part of this person, so the lateral side, so that's the vastus lateralis. You have the inside part of the person, or the medial side, so the vastus medialis, and then in between the 2 muscles, so therefore the vastus intermedius. And then the muscle that goes on top, the rectus femoris. Okay, we'll start with this one. Okay, the rectus femoris is between the 4 muscles. This one is unique because it crosses 2 joints. It crosses the hip and the knee. Okay, So for this one, I'm going to draw in the patella tendon. I don't know why they didn't include it in the picture. You know, this is a very good app, but apparently not perfect. But here we go. I'm going to draw it in. So here's the patella tendon. Okay, and then there's the tibial tuberosity. So for all these muscles, the insertion is going to be, for our purposes, the insertion is going to be patella, patella tendon, and tibial tuberosity. Okay. The action for all these is the same, and it's going to allow for extension at the knee. Okay, the rectus femoris, so we have the femur, so there's your femoris part. Rectus means runs straight up and down, so rectus femoris. Now remember, of the four muscles, this is the one muscle that crosses two joints. Okay, so this one therefore has more than one action. All right, the origin is up here on the AIIS, okay, anterior inferior iliac spine, and the insertion is patella, patella tendon, and tibial tuberosity. Action is going to be flexion at the hip, so this is a hip flexor. So runners and really any active sport, this muscle can hurt the hip flexor. So we have the iliopsoas, powerful hip flexor, and here we have the rectus femoris. So from a PT perspective, if a person has hip flexor pain, anterior hip pain, and or knee pain, don't forget to check this muscle. Okay, the vastus lateralis has its origin on the greater trochanter, okay, and then its insertion on patella, patella tendon, and tibial tuberosity. Action is extension at the knee. Okay, the vastus medialis has its origin on the anterior aspect of the proximal femur. Okay, this is the linea aspera area. And then its insertion, patella, patella tendon, tibial tuberosity. Action is extension at the knee. Okay, let's peel back the rectus femoris, and you'll see the vastus intermedius. Okay, it has its origin on anterior proximal femur, and insertion, patella, patella tendon, tibial tuberosity. Action is extension at the knee. The next series of muscles are going to be the groin muscles. Typically people refer to this area on the inside thigh as the groin. These are adductor muscles. So when you look at the midline, okay, and you're going to add the leg to the midline, it's going to have the AD or adductor names to it. I call this series the PAG muscles, P, AAA, G. Okay, the PAG, P, AAA, G. And this is in order from top to bottom as we look at the muscles. Okay, so the first one we will look at is the P, the pectineus. Okay, it goes from the origin on the pubis and its insertion on the femur. Okay, its action is going to be adduction. Okay, this next one is a little hidden, so if you look closely right there, the first A of the triple A in PAG is the adductor brevis. Okay, the origin is the pubis, and insertion is on the femur. It does have a little bit of a posterior attachment on the femur. That area is called the linea aspera. The action is adduction. Okay, the next one is the adductor longus. Its origin is the pubis and insertion on the posterior aspect of the femur on the linea aspera, about halfway down, so mid-shaft on the femur. Action is going to be adduction, and it's going to help with some extension at the hip as well. Okay, the third of the PAG, or the AAA muscles, is the adductor magnus. Okay, big muscle, so therefore the word magnus. Okay, its origin is on the pubis and the ischial tuberosity. Posterior view here, you can see ischial tube. And then the insertion is on the posterior aspect of the femur, on the linea aspera, and the adductor tubercle on the femur. Okay, right here. Action is adduction and extension at the hip. Because of its location, hamstring injuries are sometimes misdiagnosed. So in other words, the hamstring is fine. It's the adductor magnus. Next set of muscles will be the hamstring. So here's a posterior view, and we'll look at in lay terms we call them the hamstrings, but they're actually composed of 4 muscles. Okay, we have 2 muscles on the medial side and 2 muscles on the lateral side. Okay, this area also has the femur. So when we look at the first muscle of the hamstring group, we see biceps femoris, the long head. Okay, if you have a long head, that means you're going to have a short head. Okay, posterior view. All right, we have origin at the ischial tuberosity, and then insertion goes down to the head of the fibula. Okay, so from a PT perspective or a sports medicine perspective, this muscle in particular, if the hamstring is going to get hurt, it's usually this one, the bicep femoris long head. Okay, a lot of reasons for that. Crosses 2 joints. It also has a fibula head attachment, which when you run, walk, and all that, the biomechanics for the knee and the proximal tib fib is quite intimate. This has an attachment site there, and once this gets tight, and with the mechanical load that people endure when running and so forth, it's very easy to pull the hamstring. You also have to consider pelvic unleveling. So if the pelvis is uneven, which is very common, that also puts an additional strain on either hamstring. Okay, it just depends on the which way the pelvis is off-centered. Okay, the action is so because it crosses 2 joints, you're going to have some extension at the hip, and you're going to have flexion at the knee, and it's going to have some external rotation at at the knee. Okay. Also look at the hamstrings like the reins of a horse. Okay, picture yourself sitting on a horse, you're holding the reins. If the reins are relatively neutral, the head of the horse stays straight. If you pull too hard on the right rein, the head goes to the right. If you pull on the left rein, the head goes to the left. The hamstrings behave like that. Ideally, you want them to be centered, okay, equal-ish in tension. But if one side pulls too hard, then it's going to pull the knee out. Or if the inside muscles pull too hard, it's going to pull the knee out that way. And now you have some biomechanical instability, and you're susceptible to hamstring injuries and or hip and knee injuries. Okay, so treatments are very effective to get the muscle to heal and calm down, level off the pelvis, level the knees, level the whole kinetic chain because of the foundation. Is the person pronating or supinating? Is one leg longer than the other? You may need orthotics or heel lift. But once you get all that figured out, the stress and biomechanical load to the hamstrings is much less and you reduce injuries. Okay, the next muscle, which is underneath the bicep femoris long head, is going to be the bicep femoris short head. Okay, it has its origin on the femur, posterior femur, the linea aspera part of the femur, and insertion is on the head of the fibula. Okay, its action is going to be, it only crosses one joint, so it will be flexion at the knee. Okay, going to the medial muscles. Okay, you have, I call them the semis. Okay, the semitendinosus and the semimembranosus, which is underneath, as you can see there. Okay, the tendinosus is on top. Peel that back, and underneath you will have the membranosus. All right, let's look at the semitendinosus first. Okay, it has its origin on the ischial tuberosity and its insertion on the, I'm going to turn this around, okay, on the anterior aspect of the proximal tibia around the tibial tuberosity. Okay, and keep in mind you have an anterior view here. This is the medial side, so it inserts itself about right there on the medial tuberosity. Okay, it will help with extension at the hip and flexion at the knee and internal rotation. Okay, underneath it you have the semimembranosus. Okay, this is a posterior view. It has its origin on the ischial tuberosity and then its insertion on the tibial condyle, so the posterior aspect of the tibia. Okay, so the medial tibial condyle is its insertion. Action is extension at the hip because it does cross two joints, and the other action is flexion at the knee, and it will help with internal rotation. A posterior lower leg. Okay, so here's an anterior view. There's a posterior view. We'll look at the gastrocnemius. Okay, in lay terms we call it the calf muscle. All right, this one we have a medial head of the gastrocnemius and a lateral head. Okay, let's go ahead and mark a bunch of structures here. Okay, then we'll isolate. All right, so here is the gastrocnemius. Okay, it does taper into the Achilles tendon and attaches to the calcaneal bone. All right, the origin of the gastrocnemius is the medial and lateral condyle of the femur. All right, so just to orient you again, here is the medial side, and this is the lateral side. So medial head, lateral head. All right, so origin is the medial condyle of the femur. As you can see there, so it does cross the knee joint and it does cross the ankle. So it's got two joints that it crosses. And insertion is on the Achilles tendon and the calcaneal bone. Okay, the lateral head is on the lateral condyle of the femur. That's the origin. And its insertion is on the Achilles tendon and calcaneal bone. Okay, its action is plantar flexion. Okay, so plantar flexion, which would allow you to basically get on your tippy toes. And because it does cross the knee, we do have some flexion at the knee that it will do. Okay. Underneath the gastroc, we have a muscle that's very similar. Okay, and that is the soleus muscle. Okay, it has its origin on the proximal area of the fibula and the tibia. Okay, posterior aspect of proximal tib fib is the origin, and its insertion is on the calcaneal tendon and the calcaneal bone. Okay, so the calcaneal tendon and the Achilles tendon are two different tendons, even though they're in the same area and basically have the same function. Okay, its action is going to be plantar flexion. The expression is you gallop with the gastroc and stride with the soleus. So the gastroc is a very powerful muscle that will allow for, like that basketball jump to really do a layup, more aggressive explosion running and sports, soccer, stuff like that, whereas the soleus is more of a stride. Okay, so that's where the expression comes from. You gallop with the gastroc, stride with the soleus. What ends up happening clinically is the muscles, since they overlap each other, okay, here's the gastroc and there's the soleus, they can end up adhering to each other, and the soleus starts to take too much pressure that the gastrocnemius should otherwise be taking. So the soleus is the one that gets hurt or tight. Oftentimes misdiagnosed or confused with a gastroc injury, but really it's the soleus muscle. And the test is really easy to figure it out, and the treatment is really easy. Now it's uncomfortable for the person to remove the adhesions and reset the muscle, but once you do, the results are phenomenal. Okay, another muscle in the posterior aspect is